Good morning, everyone. Great to be here. Thank you, Jim, for inviting me. And this has been very educational for me. As you see here, I'm an ND. I work at NUHS, which is in Lombard. It's been a chiropractic institution for 110 years. We started an ND program there 10 years ago, and our center has acupuncture, naturopathic medicine, chiropractic medicine. This is an interesting topic to me, one, because a lot of our patients have pain, although I had an epiphany listening to Dr. Joshi thinking, we sure discuss it a lot and discuss remedies, but seeing as I'm the chief academic officer of the program, we need a pain course. So I got interested in naturopathic medicine because my sister, who's a few years older than me, in the early 90s had a terrible car accident after which she had enduring pain syndrome, and it was naturopathic medicine that really catalyzed things so that her body began to heal itself. Some years later, like about 6 years ago, she had a couple accidents at work and some life stresses, some shocks that precipitated an unbelievable cascade of pain for her, and her life has been learning to manage that. It doesn't define her life, but it's been an incredible challenge for her, and I'm going to connect her with Gracie. I've seen her struggles with the medical system, the categorization approach of medicine, opioids, no opioids, yoga, massage, chiropractic, and how she's had to put together her own strategies to deal with that pain. So she's my hero. I guess if I can credit her to getting me into this profession. Seeing what she's gone through has opened my eyes. We're very close to, how much has to be done in pain, just basic awareness. So I'll be giving her a call on the way home. I want to spend south of 5 minutes just on what our approach is, and then just give some examples pertinent to chronic pain. So here's the official definition of naturopathic medicine, but it's a primary care profession. So my students do a 5,000-hour program after getting their bachelor's degrees. They take board exams. We're putting together or working towards licensure in this state, and our bills in the Senate and House have really good support. In states where that's further along, we can prescribe most drugs, and it's primary care, but the emphasis is on working on the body's ability to self-heal using mostly natural therapies. So that fancy word there, vis medicatrix naturae, goes back to the physician Hippocrates. It's basically just a $20 Latin word for that thing, that phenomenon in the body that is our ability to heal, which needs support and needs the removal of obstacles, but is an incredible thing. So there's about 5,000 of us in North America, 16 states. We have licensing laws enacted and more on the way. So that kind of gives you an overview. The mauve-colored states there are well on their way to licensure. Otherwise, it's New England, west of the Rockies, north of the border. Kind of gives you the idea, and that's where our educational institutions are located there. I'll email this to Jim as well. You probably have some web resources for this great association. If you wanted any of these slides, I'm very happy to share. Or email me. I'll put that email back up again. These are the therapies we use, so not surprising. Lifestyle counseling, clinical nutrition in a big way, botanical medicine, homeopathy, acupuncture. When I practiced in Ontario, which is where I trained, I used acupuncture daily, just fantastic therapy. Physical medicine, which can include hydrotherapy, which I'd really encourage you to learn about. There's a brochure out there, or just Google it. But hydrotherapy is, or those of you who already use it or who just know that when you're in the water, you feel fantastic, right? We use that in a very purposeful way. That's actually where this all started, was Central European nature cure, hydrotherapy, interestingly, which is where naturopathic medicine. So that's sort of like the core software behind the profession, but it's become a lot more than that. And in some states, we can do things like intravenous infusions, biopsies, things like that. But these principles really define us, that ability to work with the healing power of the body. Like all healthcare professions, first do no harm. The idea of teaching patients what is going on with their body, and then things they can do to get well or feel better or hold on. Treating cause, a lot of root cause kind of analysis, treating the whole person. So we tend to think of things systemically, and prevention, of course. And I won't spend too much time on this, but this is kind of a model that we would teach our students as the year before they go into clinic. But the idea is that, you know, we start off in some certain state of balance, and along comes some disturbing factors, and it could be disturbances to the things that determine our health. So lack of something, lack of nutrition, lack of sleep, lack of exercise, or something outside of us, like incredible life stresses or physical trauma, leads to a disturbance of function in the nervous system, in the brain, in the body, in the liver, you name it. And there'll be a reaction. The body will always react. There's always a primary disturbance, and the body reacts, and sometimes it just takes care of itself. A lot of the patients that seek out an ND were not able to address those disturbing factors on their own, or their body's natural way of shrugging things off wasn't enough, and they're into a chronic reaction, and here they are stuck. And of course, this eventually leads to problems that are very difficult to shake without help. And so we tend to look at things like that rather than just a lesion, one isolated little thing to fix, although sometimes that's all it is, but typically we are dealing with more chronic things with patients. So in our approach, we'd first of all ask, well, what's driving the pain? We'd certainly want to make a diagnosis as best we can, but keeping in mind that there's things that are driving pain that are different for every patient, that are a little bit different for everybody. You know, is it something as simple as impingement of a nerve, or is it more? You know, a very good friend of mine who's a couple years older than me, he's in his early 50s, had stenosis, foraminal stenosis, impingement of a nerve. They fixed that for him. They took out the discs in his back that were impinging on the nerve, fused his spine, and he still has tons of pain. So obviously the experiment, he now knows that there's more to that for him in terms of the causal factors for his pain. And he wishes he'd put that off a few years, but he has a job that involves a lot of travel. Metabolic issues or nerve damage due to diabetes, which is something we see a lot. Pain signaling dysfunction, and it was great to hear from experts on that this morning, which is a huge area that is, you know, well, I would say poorly understood, but not poorly understood. There's a lot of information out there that needs to be more widely disseminated. And high systemic levels of inflammation, which is something we would get into a lot in our kind of practice. So here's an example for you with the determinants of health, which is really important to us. In other words, to do interventions for us without addressing these determinants is kind of like spinning your wheels. You're working uphill because you're working with something that's 100% as bad as it has to be instead of maybe 80% or 60% or 40%. So sleep, exercise, hydration, supportive relationships, nutrition. Now, in spite of the fact that we all have the Library of Congress in our phone, in our pocket or purse, do these things still matter because we know about them? Yes, they do. Most of our patients that present to our medical center need help with that, as do I. I often, because I'm busy and have small children and have some of my own issues, you know, health-wise, which I've been able to address through a lot of help, interestingly using a holistic approach. We all need support with these. So here's just an example, a simple study. limited because of small sample size and the fact that they were dealing with patients that their baseline wasn't coming from a lot of pain. But it's just interesting for NDs to study physiology. They basically mildly dehydrated these patients, and several indicators of basically how quickly their nervous system wants to pick up on pain signals and fire and etc. Increased because of hydration. So something as simple as hydration, this is just one little snapshot, can greatly amplify that. That's also true of asthma and other things. After about the age of 15, our thirst mechanism stopped being a reliable indicator of optimal hydration. So your brain, or my brain, may say that one glass of water took care of my thirst, but that doesn't mean that I'm completely hydrated. So that's why we do a complete inventory of our patients, to look at those determinants of health. We want to address those before we start getting into supplements or anything else like that. Or vitamin D deficiency, which is, especially in the elderly, has been called an epidemic. And if you haven't, I would ask that you ask your physician to have your vitamin D levels checked, especially if you live in the Chicago area, especially in February. And because we wear sunscreen and other things like that, a lot of us have depressed D levels. And it's not uncommon to find people, below 40, below 30, below 20. That will often exacerbate pain syndromes for many patients, as well as lead to inflammatory changes in the body. It was great to hear inflammation mentioned several times. And, a common simple issue for a lot of patients is simply that the ratio of fats in their diet is not what they really need. They, because of, food from a plant and other things, they have a lot of what are called omega-6s in the diet, and not enough omega-3s. And it's more about the ratio. It maybe should be about 4 or 5 or 6 omega-6s, like corn oil, to omega-3s, like fish oil, in the diet. And for a lot of folks, it's 10 to 1, 12 to 1, 14 to 1, because so much processed food. If you read labels, you will see soybean oil, rapeseed oil, canola oil. It takes a lot of work to get those oils out of a seed if you had to do it with your own hands. But pushing a shopping cart through Joule, it's no work at all. It's coming at us from all directions. So we definitely care about that balance. And when those oils are out of balance in the body, it supports a certain biochemistry that can lead to more inflammatory changes, a cascade, if you will. Those fats are not the sole driver of inflammation in the body, but they are a big influence. They're part of the precursors to some molecules that enhance pain and inflammation, and even to the point of impacting our genetic expression of pain signaling molecules. So again, products like this are popular, and I encourage everyone to think about food, walnuts, chia seeds, ground flaxseed, those sorts of ways of impacting the balance versus processed food. And more natural you can eat, the better. Just an example of what would be in a product like this. A lot of these EPA, DHA, which you can certainly get from fish, although with 7 billion people on the planet, I think it also behooves us to look at non-fish ways to get those things as well. Here's something. I'm not an anesthesiologist, obviously. This was from British Journal of Anesthesiologists, but because it involved a plant extract, it popped up in my usual research. I definitely tell people to use capsaicin or to eat chili peppers if they can tolerate them. I happen to love them. Some people can't, but they're great for our heart patients at the clinic in that they're blood thinning kind of effects. But here is an interesting thing. These patients had neuropathic pain. Now, the etiology was diabetic neuropathy in most cases, so I don't believe this would all be translatable to everyone here this morning, but I just want to show you an example of a second example. You've heard about cannabis extracts this morning. They used an 8% capsaicin patch. So capsaicin is the molecule, the hot stuff from chili peppers, and there's a cream for arthritis of the hands that people like, which is 0.025% capsaicin. So this is an 8% patch. The nurse has to wear a mask. The patient has to be draped and separated from it. But a 1 hour application of this led to ablation of pain for about 6 weeks for these patients. And these are patients that are, it's in the Journal of Anesthesiology for a reason. They were, used to using Demerol and fentanyl patches and things like that, and this caused enormous reduction. We used to think capsaicin depleted something called substance P from nerve endings. The research now indicates that it actually stuns the pain receptor nerves. It defunctionalizes them. Doesn't kill them, which you wouldn't necessarily want, but defunctionalizes them for about 4 weeks. So just a simple plant extract delivered in a medical setting caused huge impact for these guys. Here's something more common, say in our clinic, boswellia extract, which is frankincense, curcumin extract, turmeric extract, but these are, you'd have to take a lot of frankincense tincture or eat a lot of curry powder to get the level in this kind of supplement, which modulates inflammation. Again, it's not as, it's certainly not a kind of modulation you'd see, say, with a drug like prednisone, but that's not the intent of it. It's to modulate inflammation in patients. And these are very safe products, although I will point out that a lot of herbs, they usually cross paths with some drug or another in the liver or in the body, so you always want to have all the information you can about herbs and how they play with drugs, because sometimes they don't play well, and that is a serious thing. I teach my students to use databases to screen for drug-herb interactions and to encourage our patients to always tell their medical physicians and others what they're up to. Very important to communicate. These are herbs that have pain-relieving properties, which are sometimes amazing, like St. John's wort, which unfortunately does interact with a lot of meds. But there's at least a dozen targets in the central nervous system for about half a dozen different compounds from this herb. In history, it was used for nerve pains. Now we know it for depression, right, as a supplement. But going back for years and years, it was used for neuralgias. And German pharmacologists especially have done a lot of work on this over decades. And it's an amazing herb. Black willow bark, of course, the precursor to aspirin eventually, or passion flower, which is one of my favorites. It impacts a system in the body and the brain, the GABA system, and it's very good for nervousness, but also anxiety associated with pain. But again, these go a little beyond nutrition. They have chemicals that bind to receptors. And so, although they're not food and they're not drugs per se, they have similarities with medications. And so we always look very carefully at what else somebody is taking. So natural pharmacology is something that we do get into and sometimes can work very beneficially for people, especially over the long haul. But we would always look at these determinants of health first before jumping to that. We feel like we'd be, as NDs, would be doing a poor job if we just sent someone out the door with $300 worth of supplements without doing a really careful inventory of who they are, what triggers their pain, what their state of health is, how they got there, what their obstacles are, what their challenges are, and listening very carefully. Often, we have to do a lot of research and deductive thinking, but the patient is telling us so much, and we're often thinking about these things, and it's extremely important to it will save everyone a lot of time, kind of listening to what their biography is. Just some supplements. I'm going to go through these, and then it's question time, but Alpha-lipoic acid has been shown to be helpful in neuropathy, a very safe antioxidant supplement that actually supports the mitochondria of the body, which has tie-ins with muscle function, heart function, but also has been shown to reduce neuropathic pains. St. John's wort, again, an incredible substance, which we're still discovering new pathways for it, but it does have some herb-drug interactions that can be pretty serious. So it's always something you want to do with some sort of guidance. Intravenous vitamin C has been useful for some people with pain, also for immune support. And in Ontario, we could do it. I can't administer it to a patient's here, but vitamin C IV can be a wonderful adjuvant treatment for a lot of patients with fatigue and pain. And I think it was absolutely great that we were able to hear about medical cannabis and some of its ramifications. I encouraged my sister to get onto CBD oil a few months ago, and they just started a CBD and cannabis clinic in Windsor, Ontario, which is where I grew up, which is where, after living all across North America, she's ended up again. And it's been a great tide turner for her. So it's not the only thing that she does, but it's been an incredible adjuvant for her. Just quickly, you'll see in some antioxidant formulas what are called polyphenolics, which can be really helpful. Things like quercetin, the epigallocatechins, flavonols, which you'll find in green tea. If you drink organic green tea, I'd be careful with non-organic because it's a big cash crop in China. Probably has a few pesticides on it, but organic green tea. We've always thought of this as great antioxidants to protect your arteries and your brain. We're now seeing that there's direct impacts on some of the molecules that can drive inflammation and pain perception up and down in the body. So these polyphenolics, which you'll get from plant foods as well, you had some advice this morning to try to eat from nature's pharmacopoeia, from plant foods. It's actually the best way to get polyphenolics, but you can supplement with them as well. There's curcumin from turmeric, and resveratrol from grapes. Powerful, powerful substances. Everyone's different. We do have to categorize people to do scientific research, but that's not really who sits in our office. It's an individual with their own biography, their own pathobiography, and they're not a category. That process of reasoning is important to make knowledge, but medicine is a humanistic and a social science as well as a biological science. So we always come back to that thought that I'm sorry, I'm a little wedged in here and I'm used to wearing my mic. Our individualization is extremely important for patients, including with nutrition. So these are some of the key foods you don't need a doctor's prescription for or to see a naturopath to get, and I'd encourage you to up your intake of. And communication is very important. So in a recent survey, about a third of patients who use CAM didn't disclose to their medical doctors that they were using it. Why do you think that would be? Are they just secretive types, those CAM users? No, they didn't want a negative response from their physician, and they may have been very dependent on that physician for care, so they just didn't want to rock the boat. So, I mean, hey, it's just natural stuff. That's not always a good strategy, and so the more communication, the better. There's my contact info. I can send you these slides if you're interested, and it was a pleasure to get a chance to see you this morning. Thank you.